Hello, I'm Dr. Kavitha. I'm a consultant nephrologist working at Citizens Hospital in Nalaganla. Today, I would like to talk about high blood pressure in the younger age group people. So we all know that blood pressure is a common thing, and it generally occurs in the elderly age group. But we all should also be aware that blood pressure is also common in the younger age group. But unfortunately, a lot of youngsters are ignoring this high blood pressure, and because generally when they have blood pressure they do not have any symptoms. So sometimes they go to the doctors for any health checkups, and when they check the blood pressure they see that it's high, and initially they may take some treatment, and sometimes they forget to take treatment, or they think, okay, my blood pressure is fine, and they stop the tablets. And other sad thing that we see these days is they don't come back for regular checkups, and because blood pressure, even though it's high, you generally don't have any symptoms as such. Symptoms will only occur in a very late stage. The reason I emphasize why it is important to monitor the blood pressure youngsters is generally if the blood pressure is high in the younger age group, say for example something between 20 to 40 age group, generally you have any underlying problem that's causing the blood pressure. So underlying problem can be because of any heart issues or any kidney issues or any hormonal imbalance. So we recommend that anyone is diagnosed to have high blood pressure in the younger age group, they all need to undergo tests like blood test to check the kidney functions, urine test to check for any protein in the urine, and heart test, and also hormonal test. Because we have to treat the underlying cause, find out what is causing the blood pressure, and treat the underlying cause of blood pressure. And majority of them will have underlying kidney disease. It is very important to find out early, because if we find out the problem with the kidneys early, we can treat it early and prevent it from progression of the kidney disease. So if we leave it too late and we don't treat the blood pressure again, you have blood pressure because of kidney disease, and high blood pressure will cause worsening of the kidney disease. And we are seeing more and more youngsters coming in the 30s or early 40s saying that, my kidneys have failed. So when we talk to them, they said, okay, 10 years back I was told I had high blood pressure, and unfortunately I didn't go for checkups. And when they come to us, and they're coming in a very late stages, and unfortunately there's nothing much we can do about it. By the time they come, they already kidneys have damaged, and most of them end up on dialysis. So my plea, or I would suggest to all the youngsters between the age group of 20 to 40 years, if anyone is diagnosed with the blood pressure, please get your kidneys checked, your heart test done, and if there's any problem in your kidney test, like for example in the blood test, there's a blood test you can do called a creatinine, which will tell you what your kidney functions like. And also it's mandatory to check a urine test. So if you have any blood or put in the urine, that's an indication of a kidney disease. So if you find out early, and you can come to us and we will see what's causing the kidney problem and treat the blood pressure, you can prevent your kidneys from getting worse, and you can delay the need for dialysis in the future. So please get your blood pressure checked, get all your tests done. And also I would recommend that, a lot of people take the tablets and they say, okay, my blood pressure is controlled, I don't need to go back to the doctor. You would need a very periodic checkups done regularly, blood tests, urine tests, blood pressure checks. And your blood pressure tablets may need to be adjusted according to your blood test and urine test. So please be under follow-up, get your blood pressure checked regularly, take your medications regularly. Another important thing would be also to be following a diet and exercise. So diet and exercise are also very important to manage your blood pressure, like taking a low salt diet, and regular exercise of 30 to 45 minutes per day, and avoiding all the junk fatty foods and fast foods. In addition to this, taking medication, all other measures like diet, exercise, and following a healthy diet will also help you control the blood pressure. So I would recommend that you follow all this and be in touch with your doctors on a regular basis in order to avoid complications of high blood pressure in the future. Thank you.